Welcome, the big topic. Not only for our purpose today, but for the future. Most people throughout the world sitting in positions for prolonged periods of time, hours, 8, 9, 10 hours a day. At the desk, at home, in the car. We're abusing our body, abusing those hip flexors. The topic is anterior pelvic tilt. Anterior pelvic tilt is very complex. And I ask you, and I'm telling you at the same time, you really need to delve deep into this topic because it's not so simple. You hear many people here throughout the internet talk about anterior pelvic tilt, about do this exercise for this, do this exercise for this, do this stretch, contract, pull, but it's a lot more complex, and I'm going to delve deep into this topic today, so I hope I keep your attention. Now realize that all the sitting you're doing is causing the hip flexors, the iliopsoas muscles that attach to the lumbar region, attaching into the lumbar spine, the pelvic, as well as the hip region and the femur, that this is actually causing a lot of distortion. It's causing the pelvic to shift forward. It's causing the lumbar spine to increase its lordosis. It's causing a whole lot more complexity than you can imagine. Realize that this is also causing internal rotation of the hip. It's causing changes of the angle of the knee, along with knock-kneed, along with flattening and pronation of the feet. Now realize the pedal foundation basically states that everything that goes on below, everything above has to follow. So we have to understand that is this condition coming from below, or is it coming from here? Or one very important point, and probably one of the most important points, is forward head posture. Forward head posture, again, we spend about 80% of our life looking down. I mean, we're sitting at a desk, we're looking down, we're texting, we're at a computer, we have our arms elevated. When we're driving, our head is forward, it's not in line, our ears are not in line with our shoulders. This in itself is causing a lot of excessive stress on the posterior muscles of the neck, the interscapular muscles, stretching of those upper traps, stretching of the SCM, stretching of the retractors, contracture of the suboccipital muscles. We're developing excessive contraction of the pectoralis muscles, major and minor, causing pronated rounded shoulders. Now realize that when the head goes forward, the muscles between the blades are stretched, they become weak. We get this hunching over called a hunchback, and eventually what happens is the abdominal muscles become extremely weak, obviously affecting the back muscles, causing that excessive lordosis, which can occur from this forward head posture, from the anterior rotation of the pelvis. So there's a whole complexity of things going on. So the big question is, do you just correct what you see here and leave everything else alone? Well, I'm going to touch on some important things with the pelvis. We'll go over some exercises, some strengthening things that you can do. But I will tell you this, is that regardless of what you do here, you must look above. Because if you are going to continue to be in an awkward position with a forward head posture, the excessive weight of your head being 12 pounds for every inch you go forward is an additional 10 pounds of stress. That 2 inches going forward is 32 pounds of stress, and 3 inches going forward is 42 pounds of excess stress. So as this neck continues to move forward, you put that much wear and tear and weakness throughout the kinetic chain. Realize that when you have problems throughout the body, you cannot address just that problem. The kinetic chain works everything together. An anterior pelvic tilt is normal. Men generally should have 4 to 7 degrees anterior pelvic tilt. Women should have 7 to 10 degrees. In order to determine if you have an excessive abnormal anterior pelvic tilt, stand up against the back of a wall. Put your feet a little bit in front of the wall, not up against it. Bring your buttocks, bring your shoulder blades and head back against the wall. If your forward head posture does not allow you to, don't worry about that for now. Take the back of your hand and just kind of fit it in your lower back. It should kind of fulfill that curve. That means that your curve is considered normal. Now, if you have to take like a rolled up towel, something thick to fulfill that gap, most likely you are or do have a anterior pelvic tilt. What happens is when the pelvic goes forward, the lumbar lordosis then becomes increased. So as the lumbar lordosis becomes increased, that area we call hyperlordosis or sway back. So this is how I'm standing, just like this. The back of the pelvis is here, the front of the pelvis is here. As the pelvic moves forward like this, you can see that that lumbar spine increases its lordosis, causing that sway back. Generally, when you see people, you'll see their buttocks kind of sticking out more. That goes hand in hand with an anterior rotated pelvis. So what I like to do is show you an excellent, probably the number one exercise that you'll do with this condition is that we're going to work this in a dynamic fashion, not only a static fashion to help strengthen or stretch a muscle, but I want you to look at the dynamics as I stand here. And if my pelvic is rotated forward, now I have a sway back just like this. So ideally what I want you to do is I want you to contract your abs and squeeze your buttocks and kind of stick your front forward as you squeeze your buttocks, as you pull down, as you want to rotate back. Now watch my pelvic. Forward. Okay. Here's forward. I have a sway back like this. Now what I'm going to do is I'm going to go ahead and squeeze my abs and my buttocks, and I'm going to go ahead and bring it back. Okay? So forward, back. So this is the exercise I want you to do. As you squeeze the buttocks and your abs, you're bringing it back. You're rocking it. So ideally, if you look at my buttocks here, okay, here it's forward and here it's back. See it rock? As it goes forward, as it rocks back. Forward, squeeze those abs, rock back. Forward, squeeze those abs and rock back. Okay, this is what we're doing here. So as we do this, we're dynamically pushing it and allowing those muscles to contract, because as we bring the pelvic, as you rock the pelvic back, okay, you're engaging different muscles. And the important thing of this is that every activity and every exercise you do, you have to engage those abs, strengthen those abs. You have to engage the buttocks and even squeeze those hamstrings, because those are those inactive muscles that you have to strengthen. Let's look at the biomechanics of the spine. Here's the back of the pelvis. Here's the front of the vertebrae. When we walk, generally what happens is the back of these sacroiliac joints, okay, they go like this, side by side. They move back and forth like this. And we look at the pelvis here. This would be a posterior pelvic tilt when the back of the pelvis rotates back. An anterior pelvic tilt is when the pelvic rocks forward. Realize that when the pelvic rocks forward, you can see the increased lordosis starts to occur like this. If you look at that lower back, and this is as a result of those hip flexors that are attaching among these lumbar vertebrae into the pelvis, into the actual hip joint and the femur in itself, causing that excessive contraction. But the problem here is that this throws the whole dynamics of the kinetic chain off. Another very important topic is that when we develop an increase of sway back, we have increased stress within those disc structures, making these disc structures more prone to have injury and degeneration. Understand that as the balance of the body becomes thrown off and the majority of weight from the upper torso is being taken place upon the lower back region, you can see that the discs can actually degenerate quicker. You can develop bulging discs, as this shows right here, or herniated discs when the discs fibers or on the annular fibrosis actually tears and the inside gel or nucleus protrudes outwards. With an anterior pelvic tilt, you'll notice tight back extensors. We will have weak abdominal muscles. There'll be tight hip flexors, which are the iliopsoas muscles, and the glutes as well as the hamstrings will be extremely weak. By far, strengthening and correcting posture, particularly in this particular weakness of anterior pelvic tilt, we want to dynamically use many muscles. If we're just going to use one muscle statically or stretch it or strengthen it, it still will be of help. But nothing can compare to this particular technique I'm going to show you. Understand that muscles have memory. So therefore, I ask you to do these exercises and stretches over a period of time so things can change, so the brain can change its normal communication with how things were sitting in the past. So when our pelvis is rotated forward, we want to engage those weak muscles of the abs and the glutes and the hamstrings by squeezing the abs and contracting those glutes and squeezing the back of those hamstrings. We're going to rock the pelvic back. Now the way to know if you're doing this correctly is put your hand again behind your lower back and go up against the wall. The gap in your lower lumbar lordosis should be fulfilled, or if it's excessive, obviously we want to bring it back. So what we're going to do, we want to squeeze the ab and the glutes and hamstrings and rock the pelvic back. And by doing that, you'll feel that the increased lordosis that you have will be less. It will lessen. The back should start to flatten out. Go back in the forward pelvic tilt. You feel the increased curve. Now again, squeeze the glutes, the abs, and the hamstrings, and watch how flat that back gets against the wall. Go back again. Squeeze it again. The glutes, the abs, hamstrings, and you'll feel that the increased curve of your lower back becomes lessened. It becomes decreased as you continue to do that posterior pelvic tilt. So anterior, okay, squeeze the glutes, squeeze it to make that curve less in the lower back. Good. You can do a set of 12, do 3 sets of those. You can do those every day if you like. But continue to do that exercise. That will dynamically make the most change with that anterior pelvic tilt. A quick check on forward head posture, making sure that you're doing chin tucks from the side, keeping your chin level, tucking it straight back as you get a double chin. As you go forward to backwards like this without bringing your head forward or extending it, you want to do these particular tucks as you're strengthening the anterior flexor muscles, which will actually help support those particular postural muscles, keeping your ears over your shoulders. I ask you to go ahead and making sure that you're getting in the door, stretching those chest muscles, strengthening those rhomboid muscles by actually pulling backwards. Okay, those muscles between your shoulder blades are very important. Making sure you're changing positions frequently. If you're sitting, getting up more often, you need to make sure that you continue to work on that poor posture. Realize that the pedal foundation of your arches, if your arches are falling inwards and you are pronated, that can throw the angle off of your knees and hips, causing potential weaknesses of those muscles in the pelvic region, which can cause the pelvic to shift forward, causing an increased lordosis. So make sure you have a good arch support, make sure that your gait is normal, make sure you're not wearing the outside of your shoes out near the heels faster than you should be. That would be an indication of pronation or inward tilting of the foot, and possibly you may need a pair of orthotics or a good support to correct that problem. For the hip flexors, just go ahead and get on your knee, keep it 90 degrees, the back leg here, 90 degrees in front, keep the back straight, and all I want you to do is I want you to lean forward, and as you lean forward, I want you to feel that stretch on that back leg, right into the hip area. Those are the hip flexors. And you're just going to kind of keep pushing forward, keeping the back straight with good posture. And let that stretch just burn. Hold it there a good 30 seconds to a minute. You can do that a couple times and do it as often as you need to. Very, very effective. Now, if you want to get a deeper stretch, you can take a rolled up towel or something thick, put it behind that knee on the floor. That will bring it up a little bit higher up. And now when you stretch down, wow, you'll even feel a better stretch. I like it with the towel. I like it that it brings the hip up a little bit higher so I can really get that really good stretch into that hip flexor, that iliopsoas muscles. Great stretch. It's going to do a lot of good for you. This next exercise is one of my favorites when it comes down to strengthening those glutes. Very simple. What I like also about it, we're going to compound this into another exercise. We're going to strengthen the hamstrings at the same time. This is going to be a glute bridge as well as a hamstring strengthening exercise. It's going to be done in 2 different parts. We'll lay on our back like this. What we'll do, we'll go ahead and we'll bridge up with the glutes, keep everything in line, your stomach, and just kind of hold it up. Perfect. Hold it up. And now what I want you to do, I want you to take one leg out like this and hold it out just like that for 5 seconds. Perfect. And you'll really feel the opposite glute and the hamstrings really, really contract. Let's go back down. Let's do the other one. 5 seconds. 1, 2, 3, 4, 5. Now keep that butt up. Okay? Let's go the other one. All right? 5 seconds. You see what I'm doing here? Come down. Keep that bridging up. Do the other one. 5 seconds. You'll feel the opposite glute and the hamstrings really contract. Amazing. Now, if you can't put the leg out yet, just work on the glute bridge. Hold it up there for about 15, 20, 30 seconds. Come back down. You can come up again. Good. All right, hold it there. Now, the objective here is to hold it as long as possible, even up to a minute or 2 minutes. But if you're going to go ahead and do the exercise with the hamstrings by pushing it out 5 seconds, it's going to be a lot harder, more difficult. You got to be a little creative. Come on back. Do the other one. Good. Come on back. Now, you're really going to feel that. It's an excellent exercise. You can do sets of 12. You could do 1 set if you can tolerate it. Work up to 2 sets, work up to 3 sets. Again, if you're breaking those muscles down, you can rest it 24 to 48 hours and then do it a couple days later. This is something that's excellent when it comes down to strengthening those glutes and those hamstrings. Okay, remember that these abdominal muscles are very weak, and the most important thing when we work the abdominal muscles, we do not want to work those hip flexors. So if you're laying on your back and you're doing sit-ups where you're coming all the way up like this, you're working hip flexors after about 25, 30 degrees. But what I love about this ball, and I'm going to show you some different ways you can do it as well, what I love about the ball is that once you lock yourself out, you see how my knees are 90 degrees here? And once I come back, I'm actually like horizontal. All I'm doing is just coming up about 20 degrees. Just this little bit of contraction. I'm working those abs, not working the hip flexors at all. And I can actually come to the side, come to the other side as I twist. Okay, you can get the hint. These little abs, do sets of these, you'll really strengthen them up. They're extremely good. Now remember, when you do those abs, do not come up more than 25, 30 degrees. If you're laying back, it's always good to have something to support your neck. If your hands are supporting it, don't pull on the head, don't pull on the neck. Okay, keep the knees bent like this. That will lock out the hip flexors when you come up. Little crunches. And when you do little crunches, you'll go ahead and you can go to the side. You can work the obliques. This is it, just like this. Very simple. Those are mainly going to work the upper part. To work the lower abs, you just straighten them out. You can put your hands underneath your buttocks area, and then what you'll do is just lift up a little bit and come back down. Okay, lift up a little bit and come back down. Try to relax your neck and your head. Leave your head down so you don't hurt your neck area, but little raises like this. You don't have to come all the way up. Just little raises like this is going to strengthen your lower abdominal area. You can do several sets of those. You can do 15, 20 a set. Again, if they're fatigued and they're weak and they're hurting you, give it a couple days to heal so those muscles get stronger. As you can see, that anterior pelvic tilt is a very complex problem. But understand it does not always come from the symptomatic condition that you're suffering from. Realize that because you have symptoms or pain in here or in the back, it may not be coming from that exact source. You have to look at the whole kinetic chain, the forward head posture, your posture, around the shoulders like kyphosis, your altered gait, the improper support that you have within your shoes, your fallen arches, changes that are occurring in the ankles, knee, and hips as a result of that pedal foundation being thrown off from below. So just look at the whole picture. Understand that there are many different possibilities, but when you knock the causation out and you can hit the causation on the head and find out the source of where it's coming from, these conditions are a lot easier to correct and a lot faster to get well. Now you have a lot of knowledge on what you can do to conquer this problem. Remember, muscles have memory. The brain is used to seeing things in one way because it's something that's been repetitive for so long. Continue on these stretches, continue on these exercises, continue to change your poor habits. realize that this is just not a unidimensional problem. It just doesn't come from where the problem sits. That forward head posture must change. The gait must change. You need to make sure you have good supports for your arches, making sure you're not rotated, which is throwing the foundation off with the knees and the hips, which can potentially cause that anterior forward pelvic tilt. So put this to work. I wish you a lot of luck. I'd like you to leave your comments below, ask you to share this video. Subscribe if you haven't, because I'd like you to receive more of our educational self-help videos for you and your loved ones and family. And most important, make it a great day. I'm Dr. Alan Mandel.